We take a look into a kind of secret society. Baby boomers ready to do whatever it takes to stay young.
If your levels are low and I bring you back to a normal level or an optimal level, then aren't I just, leveling the playing field?
We don't have guidance in the medical research that suggests it's safe to stay at those levels.
Doctors seem split on testosterone. Is it a valuable anti-aging tool or an unnecessary risk? In my opinion, testosterone is an incredibly powerful hormone that plays a crucial role in regulating energy and overall health. And it works really, really well. It works so well, in fact, that a whole new industry has emerged in the last 20 years around supplementing aging men with testosterone.
In the 3 years he's been taking T, Chris says he has transformed himself into a younger man. 2 hours more work per day, 30 pounds of fat gone, and muscles. Bulging muscles, more impressive than anything he had in his 20s.
Are the days of withered old men gone? Where do you draw the line between testosterone replacement and just straight juicing? Let's take a look through the microscope of truth and get a scientific understanding of TRT beyond the productization of hormone therapy. I'm Marco, a former weightlifter turned doctor and pharmacology researcher. Subscribe to join me as I do deep dives on the medications I find fascinating. As we age, testosterone levels naturally decline in both men and women, and this can lead to a variety of symptoms.
Less energy, put on a few pounds.
You said it.
Lower drive, can't get hard anymore.
Well...
So what is considered low testosterone? Levels below 300 nanograms per deciliter are generally considered low, and this usually presents after the age of 50. In recent years, there has been growing interest in using testosterone replacement therapy as an anti-aging medication.
57-year-old CEO Chris Running showed us as if it was no different than a glass of orange juice.
But here's the thing, clinical criteria for testosterone replacement therapy is not solely based on testosterone levels. Doctors typically look for testosterone levels below 300 nanograms per deciliter and the presence of symptoms associated with low testosterone, such as decreased libido or muscle mass. However, even this is potentially not enough evidence for some of the doctors I've spoken to. They would only prescribe TRT after a testicular amputation after cancer. When I was in medical school, an endocrinologist laughed at me when I asked them what they thought about TRT. I'm not going to prescribe testosterone so some old man can get an erection. This type of black and white opinion leaves men vulnerable to pharmaceutical ads like this.
Let me guess. You can't get hard anymore, huh? He came up to us and told us he couldn't get hard anymore.
Let me guess. You just turned the big 3-0.
30?
It happens to every man.
Personally, I find this conservative opinion short-sighted. But nowadays, when it comes to TRT, there are doctors on the other side of the spectrum as well.
We wondered, can it really be that simple? Dr. Karin Power says, yes.
And I hear a lot of men come in and they talk about the young guys coming in and they feel the challenge.
Is that okay or is that cheating?
If your levels are low and I bring you back to a normal level or an optimal level.
Optimal level.
What is the optimal level of testosterone? 1,300 nanograms per deciliter.
You are correct.
Some doctors are very liberal with their TRT prescriptions and will prescribe testosterone to patients with no symptoms at all, and even prescribe to a superphysiological level. A superphysiological dose is the administration of testosterone at levels that are higher than what the body normally produces.
More impressive than anything he had in his 20s.
More impressive than anything in his 20s.
I would like to introduce the idea that increasing the dose of testosterone above the level for your age is superphysiological. Increasing it beyond your human capability should be something else, like hyperphysiological. Obviously, each person has their own sensitivity to testosterone, but testosterone replacement should not be considered outperforming your natural peak at 20 years old. Otherwise, that's just regular old doctor-approved juicing.
Honestly, I like looking at myself in the mirror because I look freaking awesome.
That doesn't mean you can't have great benefits from a small amount of testosterone, especially if you have no prior exposure. But the real reason these superphysiological levels are to be avoided, in my opinion, is this is the zone in which diseases start to rapidly manifest.
The lowest possible dosage of testosterone therapy is going to be better.
Chris Running and the growing number of boomers just like him aren't worried.
There have been several studies that have investigated the relationship between the dose of testosterone and its side effects. 2 meta-analyses found no differences in cardiovascular events like heart attack or stroke between TRT and placebo groups.
The bottom line, you're sold.
Well, I'm absolutely sold. I will never not do this.
However, in trials not explicitly funded by the pharmaceutical industry, The risk of a cardiovascular-related event on testosterone therapy was significantly higher than in trials funded by the pharmaceutical industry. And on top of that, the most commonly used testosterone doses were 100 to 150 milligrams per week, already a significantly lower dose than what optimal care is prescribing.
Optimal level.
At the end of the day, it's important to consider that doctors and research have their own biases, and that which doctor you choose will dictate the treatment regimen you receive.
Many people do not need testosterone replacement. Young guys should really avoid doing anabolic steroids. It can really mess up their system, not just physically, not just for the ability to have kids later, but lead to all sorts of sexual issues and sexual performance issues. Like, there needs to be some medical incentive